Hello everyone. Today we are going to learn complete yogic breathing. Our breathing system or respiratory system is the bridge between our consciousness and subconsciousness. That means our body and the mind. So the breath can be used to keep ourselves physically healthy and also to keep ourselves mentally alert and agile. But generally our breathing is not perfect. We breathe in short, shallow breaths. We breathe in very fast. This way we use hardly 10 to 15% of our whole lung capacity. So this poor habit of breathing, it can lead to many physical and mental ailments. So it is important to correct your breathing, to do it with more awareness, and this can be done only with the practice of complete yogic breathing. So let's learn today complete yogic breathing. Now let's talk about the benefits of complete yogic breathing. Number one benefit is it corrects the faulty way of breathing. Second, we start using our lungs in a better way by using all the lobes of our lungs, which results in better oxygenation and more vitality, more prana. Third, it's extremely good for people who have cardiovascular issues. Um, there is a significant reduction of anxiety in the patients who have cancer when they practice this complete yogic breathing. It's very good for anger management. There is a distinct improvement in concentration, clarity, and calmness in the person if they practice complete yogic breathing. And also, it is good for all the stress related disorders. But you should not be doing this practice all the time, 24 hours a day. Only after your asana practice, 10 minutes of practice of this breathing practice is perfect. So now let's start. Before starting that, there are few practices to open up your chest area. So first to practice, we will do standing up. So for that, let's stand up. So now standing practices before starting complete yogic breathing to open up your chest area. So for that, stand straight, 1 inch gap between your feet. Inhaling, raise both the hands. Exhaling down. Total 3 rounds, 2 more. Stop the practice. This opens up your chest area vertically. It works on the diaphragm. The second practice is we are going to open our chest area horizontally. How to do? The same way, but your feet should be like that. Both the palms straight, both the arms and the palms joined. Now inhaling shoulder level. Take both the arms back as much as possible and exhaling, bring it back. 2 more rounds. Hands down. The second practice, it opened up the chest area horizontally by expanding your rib cage. So these two practices are very essential before starting complete yogic breathing. Now we have to do the sitting asana. So the sitting asana we are going to do is Padadhirasana. For that you have to sit in Vajrasana. Knees joined and both the big toes joined. Your spine straight. Both the palms in opposite armpits. Right palm goes here, left goes here. All the 4 fingers inside, only the thumb is outside. Now, using your upper arm, press those palms. Close your eyes, 3 rounds of normal breath. The name is Padadhirasana. Breathe consciously and gently. Open your eyes, take out your hands. The benefit of Paddirasana is it opens up the blocked nostrils, which can result in smooth oxygen flow inside your nostril. Now let's start. So, complete yogic breathing has two parts. The first is sectional breathing or Vibhagya breathing, and the second is complete yogic breathing. You can't jump directly to complete yogic breathing. You have to prepare your lungs doing sectional breathing or Vibhagya breathing. The posture is Vajrasana is the best posture. The second best posture is Sukhasana. And if people who can't sit on the mat, on the ground, they can even do it sitting on the chair, but make sure your feet is touching the ground. And if it is not touching the ground, you have to keep folded blankets, elevate it, and then you can keep your feet above that. Your spine has to be straight, shoulders relaxed, and mind calm while doing this practice. Don't do it in a hurry. So the first step is sectional breathing. Sectional breathing again has three parts. The first is diaphragmatic breathing or abdominal breathing. For that, sit straight, take chin mudra. This mudra activates the lowest part of your lungs. So we are going to do abdominal breathing. You're taking this mudra. Keep it on your thighs, your back straight. Bring your awareness to your abdominal area. As you inhale, your abdomen should come up gently, don't force. And as you exhale, it should go inside. This is abdominal breathing. What happens when you inhale, your abdomen goes up, that means your diaphragm comes down, and as you exhale, your abdomen goes inside and diaphragm lifts up. That's why the name diaphragmatic breathing. Let's do it 3 rounds silently with full awareness on this region. After 3 rounds of abdominal breathing, open your eyes. The next section part of sectional breathing is thoracic breathing or intercostal breathing. For that, you have to change the mudra. This was chin mudra. Now we are taking chinmay mudra. These 3 fingers, you should curl it on your palms. First 2 fingers will be joined as it is in chin mudra. This becomes chinmay mudra. Chinmay mudra activates the middle part of your lungs. Keep it again on your thighs in Chinmay Mudra. Now my chest area is activated. The middle part of my lungs is activated. Now as I have to inhale, I should not be moving my abdominal area. My chest comes up and it should go little upward. Fill up your chest area. And as you exhale, relax. This is thoracic breathing. Again 3 rounds in silence with full awareness on this area. Don't move your abdomen. Slowly and gently, be very gentle with yourself. After 3 rounds of thoracic breathing or intercostal breathing, open your eyes. The third part of sectional breathing is clavicular breathing or Adi Swasa. For that, you have to change the mudra. Mudras are important, as I told, it activates a different part of your lungs. Now the mudra becomes Adi Mudra. Your thumb goes inside at the base of your ring finger, rest of the four fingers tightly wrapped over it. If your thumb reaches the small finger or it goes beyond, that means your breathing is, you are not fast, you are breathing very deeply. With practice, you are able to do. So this is Adi Mudra, all the fingers wrapped over it. Keep it on your thighs. Now my clavicular part, the uppermost part of our lungs, which we use very rarely in our day-to-day life, that part gets activated. You can keep either like that or you can keep your mudra like that. Now, as you inhale, the shoulder or the clavicular bone goes up till your ear. And as you exhale, slowly it comes down. Now 3 rounds in silence with closed eyes, with full awareness only on this area. Be gentle. After completing 3 rounds, stop the practice. Open your eyes. So that was 3 parts of our sectional breathing. Now we are going to do complete yogic breathing uh, by combining all the 3 steps together. So what happens by combining all the 3 steps together, it is possible to inhale the maximum amount of oxygen and to expel maximum amount of carbon dioxide from your system, which will lead to calmness, clarity, and uh, it's very good for your system even physically. Let's start. So the same Adi Mudra hands, you have to keep it next to your navel. You can keep it like that or you can keep it like that. Just gently press, very gentle press here next to your navel. This becomes Brahm Mudra. This activates all the 3 parts of our lungs. So first see how we have to do. Chest open, don't slouch, keep it open. Now as you inhale, fill your abdomen first, abdomen goes up, then more inhalation, the chest outward and upward, and then little more inhalation, your shoulder or the clavicular bone goes up till your ear. As you exhale, same sequence, first shoulder comes down, more you exhale, chest goes inside, and then abdomen goes inside. This is complete yogic breathing. Let's do 3 rounds silently with total awareness on every part of your lungs. After completing 3 rounds, open your mudra, keep it on your thighs, relax completely, keep your eyes closed. The whole body is completely relaxed, you can feel it. Observe your mind. So much of oxygenation, you can feel your mind is totally serene, peaceful, calm. If you want, you can do a small meditation here by just focusing on the normal breath. Before opening your eyes, rub your palms nicely, generate some heat, some prana, keep it over your eyes. You can generate some more prana, keep it on any painful part of your body, if it is your knee or back or shoulders, whatever, you can keep. Apply external prana to that part. Now with a smile, you can open your eyes. That was complete yogic breathing. I hope you like this video. Thank you. Thank you for watching.